Speaking on the impact on health, Dr. Lino Tom highlighted how the resource sector's activities, such as mining, drilling, and deforestation, have far reaching environmental and public health consequences. Dr. Lino appealed to the resource sector players that, as leaders within the sector and their communities, they wield the power to catalyze broader change. To stop and reverse these catastrophic trends, there is a need to ensure that the root drivers are addressed, ensuring socially sustainable resource management while mitigating harm to public health and the environment. Dr. Lino further highlighted the critical need to increase the country's health sector workforce.
So in terms of the retention strategy, we just need to reduce the workload they have on their shoulders. And given the population growth rate right now at 3%, the disparity, there's a big disparity. It's widening by the day. You have one doctor to 20,000 people. A responsible government, we need to really increase the number of doctors in this country, and that's one of the strategies we have, retention strategy. We really need to provide good working conditions for them in this country.
In regards to the concept of brain drain, Dr. Lino says high-level discussions at the political level have taken place to address this phenomenon.
Because it's such a big problem and it's quite difficult for smaller countries to address this problem. We've actually, as a group, we've raised this in one of the, at the forum in World Organization in Geneva. So we've raised that issue, and we've basically asked the developed countries, to have some sense of, to have some sense of sympathy towards developing countries and not getting wealth workers from them. In saying that, like I said, every person is actually entitled to pursuit of happiness, so to speak, and life. And since they've invested a lot in terms of their life, resources in their education, it's only proper that they go to jurisdictions that compensate them well.
Meantime, representatives from Santos Foundation, and the Sustainable Development Program shared the panel with Dr. Lino, highlighting the critical work they do in the communities they operate in regards to significant health outcomes serving the people of Papua New Guinea. Dr. Lino says an integrated approach to identifying opportunities and risk for the health population is needed. Furthermore, a focus on strengthening partnerships to address mitigating direct and indirect health impacts is critical. He said there is a need to bolster climate resilience of national health facilities and build a sustainable healthcare system. This includes efforts to attract and retain health workers, particularly in rural and remote areas.